Now, such cases are usually associated with polyhydramnios. The amount of fluid is quite significantly more than the expected normals. But in this case, you are not seeing polyhydramnios. There is the amount of fluid is normal for the expected gestational age at this stage, and the fetus is really very active during in cases of Anencephaly. So let's first see the gestational age at which he has presented to me, and she came to rule out, she was referred to me to rule out any fetal anomaly, which is straight away there, and you can see the movement of the leg. Let's see what is this. This is 16 weeks pregnancy. Femur length is 2.2 centimeters, and that corresponds to the gestational age of 16 weeks. Okay. Whereas now see the body of the fetus. In transfer section, I am in fact trying to get the body of the fetus in transfer section. And what we see is we try to get the fetus in its total length, body of the fetus, then this is measurement. And in transfer section you can see that there is an outpoaching from the anterior abdominal wall. You can get it. This is the transfer. I am trying to get the transfers of the fetus. The benefit of that is that any abdominal defect, anterior abdominal defect, comes in view. And there you are seeing one. So this is the body of the fetus in longitudinal section, and this is an outpoaching which is weighing 1.86 into 1.82 centimeters, and here you can see it's continuous with the anterior abdominal wall. This is the anterior abdominal wall. This is the transverse of the fetus, and you see this outgrowth is from the anterior abdominal wall, so possibility of omphalocele cannot be ruled out. Because this outpoaching is in continuity with the anterior abdominal wall, and this being the transverse of the fetus, so the errors are suggestive of an anomaly that relates to the anterior wall of the, here you can see it's clearly a vessel is entering into this part. This is the outgrowth, and this is the anterior abdominal wall, this posterior abdominal wall. This is the anterior abdominal wall, and this is the outpoaching becoming continuous with it in this region. So we cannot take the transverse section of the fetus, and the weight cannot be calculated. Therefore, the cardiac activity is present and is 170 beats per minute, which is more than normal. This is the placenta, which is posterior wall, and it's not previa or low line, it's quite away from the os. This is now we are seeing the cervix. Of the uterus, this is the cervix, and the cervix measures 3.7. This is the urinary bladder, this is the amniotic fluid, this is the uterus, this is the fetus. So the placenta is posterior wall, is grade 2. There is no evidence of any placental anomaly. Cord, here we are, and the umbilical cord is normal, 2 arteries and 1 vein in transverse section. So it's fine with the umbilical cord. This is the face. Facial features will be seen in cases of anencephaly. This is eye, and the distance is 3.4 centimeters. Rest what you will see are the basal bones, basal head bones will be seen. So anencephaly is there, and this is a case of multiple pathologies. Anencephaly with omphalocele. This is the poor development of the vertebral column at this stage. This is the vertebral column, this one, this area. this is the length. So this is the case of the day. Showing you basal bones of the skull, the omphalocele,